Hello, hello. So, have you ever had a question? You wish you had a doctor to ask. Well, tonight's your night. I'm Dr. Catherine Toomer. I'm a family medicine and community health physician, and I'm also the founder of Total Weight Care Institute and your host of the Dr. Toomer Talk Show. And the first Tuesday of every month, I try to do a Q&A so that anyone comes in, they can ask questions, and I try to my best to answer them. Now, if you're here listening, please say hello and put in hashtag replay. I'm sorry, put in your name and where you're listening from. And if you're listening later, put in hashtag replay. Um, so again, I'm Dr. Catherine Toomer, and I'm here every Tuesday at 6 o'clock live. And so if there's no one here to ask questions, or if there are no questions coming in, I can know there's because I got some from emails and from some texts. So um, but I will answer them as they come. So say hello and ask your questions, get them ready, and I will get them for you. But hello, Marcy. How are you? From Barbados. Thank you. It's always nice to see you. Honestly, if you didn't show up, I probably think I was in the wrong place. So I'm going to ask a question. I actually got a question from someone. I got two questions. There may be some others. I haven't checked the emails, but I'll ask. So the question here, is there a point when the GLP-1 stops working? And the reason people ask me a lot about GLP-1s, I have been prescribing GLP-1s for 15 years for weight management included, for metabolic management. And we all know that weight gain is a metabolic process. So that's why metabolic medications and metabolic correctors work so well. GLP-1s are one of them. And so, if you're listening for the first time and you haven't listened to me before, I am going to explain a little bit about what GLP-1s are. GLP-1 stand for glucagon-like peptides. And what glucagon-like peptides are is that they mimic something that they mimic something in our body that our body makes, and that helps us metabolic um, with the metabolism of carbohydrates, but our food in general. So it slows down gut motility. It helps tell the brain to use insulin in order to use glucose to signal the rest of the body for what to do. So the reason they work so well in people is because most people who need them, it's because their brain's not getting the signal because it's not using their insulin properly because they have insulin resistance or prediabetes or diabetes. So there is a point when the GLP-1s may no longer offer weight loss because weight loss is simply a side effect of the medication. So what happens when GLP-1s work, they work in the brain, and the brain tells the body, take the calories that this person's eating and make fuel instead of fat. Without it, it just goes to fat. So with the medication, it helps the body get the right signal so it stops making fat. But it does a lot of other things as well. It helps the brain. Protects the brain against dementia. It protects heart against heart disease. It protects kidneys against kidney disease. It helps the whole body against inflammation. And so even when weight loss stops, the medication is still working on all the other processes. Particularly, anytime there's a metabolic issue caused by, for any reason, menopause is a metabolic issue. Chronic stress causes metabolic issues. Polycystic ovary syndrome has metabolic side effects. Chronic steroid use for people who have to use it for inflammation, for arthritis and other things, that can cause metabolic issues. And so all of these things are corrected. There's all the metabolic issues, whatever the cause of those metabolic issues, are all corrected by a GLP-1 medication. So they may not always cause weight loss, but they are always working. They never stop working. So it just like it's so, but of course, a lot of people take it for weight loss. So they think that if their weight's no longer going down, that somehow the medicine's not working anymore. It does other things. It has other benefits that continue even if weight loss stops. So that's the first question. Another question I got. And also, so if you're listening, get your questions ready because I'm sure there's some. The other question I got today was, um, oh, what are peptides? Um, are GLP-1 tirzepatide peptides. I've been hearing a lot about them and wondering if I need to take them. Okay, so what peptides are essentially are proteins. Um, so they help with so protein. Marcia, I saw your question. I'm gonna get to in just a moment. So peptides are proteins, and our body uses proteins for lots of different reasons, but these particular peptides that people are talking about are the ones that are used in our mitochondria, or the part of our cells that makes energy. So, and they help our cells make energy, and it's usually come from down from the breakdown of the food that we eat, or it's something that our cells make also. They also make their own proteins. What happens over time as we age, those proteins that our cells make, they can become less and less and less, and those cells start to age. They start to cause what they call cellular stress or aging stress. And so those peptides are no longer in the levels that they used to be, so our body does not produce the energy that it used to, and that's why our bodies start to slow down over time. So, what peptides are to replace those things. The type of peptides that you're hearing about when everyone talks about longevity and peptides, those are the peptides they're talking about. The ones that our cells use to make energy in order to give us the energy that we need for our body and for daily living. So, peptides are those things. Yes, we can take them. Yes, we can replace them, usually in the form of either injections, nasal sprays, or with pills. In that order, the most effective is injections, the next is nasal, the next is pills. Now again, they are not regulated, so not all peptides that are made equally. There are people out there who are selling peptides that are not supposed to be for human consumption. They're only supposed to be used for research. So you have to be very, very careful who you get them from and who you buy them from. So the best thing to do is to go to a physician who you know has their sources from a reputable place, basically an FDA approved, monitored facility. And there are not very many. I do have one that I vetted, and if you want me to connect you to a physician who can prescribe them, myself or someone else, then all you have to do is write to me at help@drtumor.com. That question came from someone else, but who's a listener, but sent me the question beforehand. So yes, so peptides are helpful in helping our cellular age, slowing down our cellular aging. And depending on the type of peptide that you take, they help with they kind of keep your brain a little sharper. They kind of help you focus. You notice your skin starts to improve. Your hair stops falling out, especially if you're on a GLP-1 and you have some nutritional hair loss. It will stop that. It just generally gives energy. Okay, looks like my internet decided it was gonna just kind of flip out on me. So I apologize for that. So, hi Denise, how are you? Thank you for joining. So Marcy asked, how does steroids help with platelets? So it depends on what you mean. So if you mean low platelets, and it also depends on why the platelets are low. So what steroids do is they stop our immune reaction. Excuse me, I got something on my tooth. They stop our immune reaction. So when you have low platelets, sometimes, often what it is because our body sort of fights against itself. It creates antibodies against the platelets. What steroids will do is will stop those platelets from being made, or they'll stop them from being as dangerous. And they'll stop them from being able to act on platelets. if the reason that the platelets are low are because of antibodies. And that's usually the most common reason that we would use steroids for a platelet reason. So, yes, low platelets. Okay. Got something on my lip. Okay. So yeah, low platelets, it depends. And usually it's idiopathic. Oh gosh, if I hadn't tried to say it, I could have told you. But idiopathic thrombocytopenia is usually what it is. And that's, low platelets from the fact that your body's making antibodies against the platelets. Okay. All right. I got another question. Just came in. Can you get kind of the same questions about hormones? Okay. Hormone replacement therapy. So, um, what are the best hormone replacement therapies to take? All right. Well, it depends. Don't you love that answer? Depends. So with each person, it's different. It depends on your medical history, depends on your family history. However, I can tell you one of the biggest myths about hormones, that they cause cancer. They do not cause cancer. Unfortunately, there was a lot of women who have missed out on really, really helpful hormone replacement therapy because we were told that they cause cancer. Even I was taught that. We have since learned that that is not true. There are certain cancers that if you have them, they can make them worse. So, for example, if you're a man and you have prostate cancer, testosterone can make it worse. If you're a woman who has breast cancer already, or who's highly predisposed to breast cancer that is hormone sensitive, then yes, it can make it worse. But the hormones themselves do not cause that cancer. And there are different ways of taking that taking that medication so that there really is no risk. So when it comes to women, there's 3 hormones that we replace: testosterone, estrogen, and progesterone. Testosterone helps with sexual desire. It helps with our libido. It helps with sex enjoyment. Estrogen and progesterone help with the preventative things that losing them can cause. One of the biggest things that it does is that it leaves cortisol unopposed. And so when you have cortisol unopposed, you get insulin resistance. When you have insulin resistance, you gain weight through the middle. That's the reason we gain weight during menopause. The weight gain in and of itself wouldn't be a problem, except that the place where we gain weight is through the middle. That means it's visceral fat, and it's subcutaneous and visceral. But that visceral fat goes around organs, and it makes organs less efficient. They don't work as well. So it's an indication of poor health. It is one of the health parameters that causes us issues. When your waist becomes larger than your hips, it is a health issue. That is another definition of obesity. No matter how much you weigh, no matter how thin or big or small you are, if your waist is larger than your hips, your waist to hip ratio is more than 1, it is a problem, and that is an indication of poor health. So, and it does affect your health. So what hormone replacement does is it prevents that. It also helps prevent a heart disease. It helps prevent dementia. And so it is very, very helpful. Now, there's 2 ways that you can take hormone replacement. You can take it, there's 3 ways actually. Actually 4. I'll go through them all. So you can use pills for the testosterone and the estrogen. Not testosterone, sorry, the estrogen and progesterone. The testosterone usually is in the form of a gel or cream on the skin or as an injection. You can also use progesterone estrogen as a cream on skin or vaginally. Now, there are ways to take, when you use hormones vaginally, they do not go into your bloodstream. They just stay in the vagina. And what that does is it helps with epithelial cells. That's the lining of the vagina. So what it does is it helps prevent urinary tract infections. That is one of the leading causes of deaths in women when we're older. The other is that it prevents painful sex. That happens if the lining of the vagina becomes thin. So hormone replacement isn't just preventative in terms of your health, your physical health, and your organ health, but it's also helpful with your psychological health because it does affect relationships. It does affect other things later in life, enjoyment of life. So hormone replacement is good for that. I hope I explained it better. I've explained it better other times, but for some reason I keep saying testosterone instead of progesterone when I need to. So Denise says, Dr. Toomer, I am on a reverse diet after going into maintenance. Down 83 pounds on Zepbound. I haven't lost any weight in about 2 months since reversing my diet. I lost 2 pounds. Is this normal? Now, you'll have to explain to me what you mean about reverse diet. I'm not familiar with that. Or I may call it something else. But I can tell you that weight loss happens for, one of two reasons. Either because you're not eating enough calories to maintain your body functions. And if that happens, that weight loss is only going to be temporary because eventually what's going to happen is your metabolism is going to slow down and that weight will come back. The other is you correct the cause of the weight gain, and that is usually metabolic. And that's why Zepbound works. For you to have lost 83 pounds means that there was a metabolic issue there. That's why it worked for you. Now, depending on the total amount of your body weight and what percentage that 83 pounds is, your body may just want you to stay there for a little while. The way we gain weight is we gain weight like this. We gain a little bit, then we stay, and then we gain a little bit, then we stay. We lose it in the same way. You go down and then you stay, and then for a little while, then you go down a little more, then you stay for a little while, then you go down. So I increased my caloric intake from 1,200 calories and now I'm at 1,600. Okay, so I understand what you're saying. That is a perfect example of what I was talking about. You were eating too little for your metabolism and your metabolism had shut down. So as soon as you started eating more, your metabolism picked right back up and that's why you've lost weight. That is a perfect example of your metabolism. You needed more calories than what you were eating. Because that's often the case when people drop too low, your metabolism shuts down. So yeah, that's a very perfect example of that. Yeah, so that is very normal. And I see that often. Many times when people say their weight loss has stopped, and and for health reasons they need to lose more, usually I check to make sure that they're eating enough calories. Because if you're not eating enough, it does the opposite. It's counterintuitive, it's counterproductive to drop your calories too low. But it's really nice that you can eat more. But don't ever. So this is the thing, and this is what I was saying at the beginning. Weight loss is just a side effect of the medication. So even if your weight loss stops, the medicine is still beneficial. It still has some beneficial aspects of what it's doing. It's still working in other ways. Weight loss is just one of the ways that we notice it working, but there are other things that it does. So one of the mistakes I see people doing is they say, oh, it's not working, and they stop taking it. It may not be working as fast or as well as people may want for weight loss, but it's always working in other ways to prevent, especially if you have any metabolic issue whatsoever, especially like diabetes, prediabetes, insulin resistance. Okay. Any other questions? I can check my emails and see if I find something. Let me see. Sorry about that. Usually I pull them up beforehand, but sometimes I was getting questions in a couple of different places. Log in for account. Okay. All right. What does it say? Is microdosing effective when using GLP-1 medications? It depends. Again, Depends. So this is the thing with GLP-1s and with other things. They all GLP-1s act the same way in the body, but they act differently on every single person. And a lot of times how they work largely depends on a few things. One, they depend on how much muscle you have. The more muscle you have, the more effectively they work. The more muscle you build while you're taking them, the better they work, the more effective they become. If you've dieted a lot in the past and you've yo-yo dieted and lost a lot of muscle, the medication doesn't work as well. Mainly because your metabolism has been so highly effective and because the GLP-1s work best on muscle cells so that muscles can utilize fat and utilize the glucose what you've eaten. And so the more muscle you have, the more places it has to work. And so that's why building muscle during the time that you're in any type of a metabolic process is so important. Truth be told, muscle is one of the most important things for health in general, for health now, and especially for health later. Muscle helps prevent falls. It helps people stay independent. I mean, if you think about getting up and down out of a chair, you use your legs, your muscles, and then you push up with your arms. If your muscles are weak, you're not going to be able to do that. So that means you need someone else's help. So I always say, if you don't build your muscle now, you're going to have to use someone else's muscles later to live, because you won't be able to do much on your own. So wherever you are, muscle toning, muscle building, muscle strengthening is extremely important. And it doesn't have to be strenuous. It can be in the form of Pilates. It can be in the form of Tai Chi. It can be in the form of bands. You can even do it when sitting down. There are exercises you can do while sitting down. There's exercise you can do at any age, in any type of mobility that that you can do to help build your muscle. And it's always beneficial, always. And so I harp a lot on muscle. And really, when it comes to weight loss in general, I always say it's like the 5 M's. Muscle, mindfulness, which is meditation, keep your cortisol down. Meals, which is also, because you want to make sure that you have very protein heavy meals. And medication if necessary, any medication that you may need, but also in metabolic correcting medication that you may need. And then the fifth one is medication or hormone replacement if you're in menopause, because menopause will make us gain weight because it's a metabolic issue. It creates metabolic dysregulation, and it's that dysregulation that causes weight gain. The weight gain in and of itself is not an issue. It's the fact that there's an underlying metabolic reason that can cause us problems. That's what causes our heart disease. That's what causes our dementia. And so that's why it's important to address it. So, well, we've hit the 23-minute mark. Are there any other questions? It can be a nice, short, and sweet one. Well, if there's no other questions, thank you for joining. I will see you next Tuesday at 6 o'clock right here. And I apologize for anyone who came the last couple of weeks when I wasn't here, when I had COVID and then I was traveling. I got my days mixed up. So that was my fault. And if you have any questions that you'd like me to answer, or anything that you'd like to understand a little better, please just write to me at help@drtoomer.com. I'm going to put that into the chat. So there you go. And excuse me, I still have a bit of a cough from COVID. So if you write to me there, I guess is it disconnected from my Facebook and from my YouTube? Maybe that's why. Okay. Well, if you write to me at help@drtoomer.com with any of your questions, I will answer them. And also, if you're listening and you haven't already, subscribe to my YouTube channel And please share my videos with others who may need the information and who would also subscribe to my YouTube channel. I'm trying to get my numbers up. So, um, all right. Well, thank you for coming. Thank you for, and I'll see you next Tuesday, Dr. Tumor Talk Show. Good night.